and large, women considering egg freezing fall into two main groups. Group 1 will include women when the medical reason to consider egg freezing, such as a family history of early menopause, usually on the mother's side, or when they are diagnosed with cancer and they are concerned about the impact of chemotherapy on their egg reserve. So these patients are quite often fast-tracked, obviously, in order to optimize the outcome. Then you have the other group of patients that they fall within the category of what we call social egg freezers. And these are mainly women in their mid to late 30s without any partner, who are concerned about the impact of the biological clock on their egg reserve and, of course, egg quality. You cannot compare the success rate of a frozen embryo to a frozen egg. Obviously, when you have a frozen egg, the egg will have to go through the process of egg warming, so some of the egg may not survive. The egg will have to be fertilized, and the fertilized eggs have to obviously develop to a normal embryo. So when you achieve an embryo from a frozen egg, then the success rate between an embryo that's coming from a frozen egg versus a normally fertilized embryo will be almost the same. The key in all this is egg survival. So if the egg survives, then the fertilized egg will have almost the same implantation potential as a fresh egg, as it were. By and large, from the age of 35, fertility starts declining in women. And therefore, for instance, if the upper age of egg donation in the UK is 35, and this is the reason why women do get concerned about the impact of age on their egg quality and, of course, egg reserve. The best age to freeze eggs in women who have no partner is between 35 and 40. However, when women go beyond the age of 40, one has to be very careful in terms of alerting a patient as to the importance of, number one, checking if they have good enough egg reserve to benefit from egg freezing, and number two, they should be given the full information about the impact of age on the quality of the egg, because a big percentage of the egg from the age of 40 onwards start having a chromosomal abnormality that will have an impact on the implantation potential of the embryo. So going back to what's considered the ideal age, it's obviously a very difficult area to define what is specific age, but by and large, age 35 to 40 would be the optimum age. The novel technique of vitrification, which is a new way to freeze an egg, has been a game changer in the field of assisted reproduction. It has really opened new horizons for clinicians and for patients as well, in the sense that it would have been unthinkable a few years ago to have an egg bank. And now we run a large program of egg donation using frozen egg with excellent result. This enables us to give time for matching, give the patient the right choice, etc., etc. In addition, it will also help women where, for instance, they have a gynecological condition such as severe endometriosis, where there is significant disease in the ovaries and they require surgery. As these patients now can freeze their eggs prior to undergo surgery in order to optimize the outcome. And of course, it also enables patients with history of early menopause or cancer to preserve their fertility.